Hi, this is Michael Reddy with Keystone Insurance Group coming at you with a healthcare reform question of the day. And today our question comes from John in Kentucky, and it reads, if the test for affordable coverage for an employee is that the single coverage under the group plan is no more than 9.5% of the employee's income, then in making a determination if a person qualifies for a subsidy, is the entire family income taken into account, even if all family members are not going to be covered by the group? Also, if one member of the family does have affordable coverage available to them, does that disqualify the other family members from being able to get a subsidy through the marketplace? Now, the first part of the question revolves around the affordability test and whether or not it qualifies. And the affordability test is essentially this. If the employer is offering single coverage that is less than 9.5% of the employee's wages from that employer, it would be considered affordable. Now, wages from that employer are defined either by box one income or by their monthly salary or their hourly rate times 130 hours, or using the federal poverty level safe harbor, the determination can be made that way. If the amount that the employee is required to pay is less than 9.5% of any of those measures, then it is deemed affordable. Going on and answering the second part of the question, if an employee or the employee's spouse has affordable coverage available to them through their employer, and that coverage is available, single coverage is available to the employee on an affordable basis, and it's qualified coverage, that will render the employee and their family from not receiving a subsidy on the exchange. There is this family glitch in the Affordable Care Act, and it truly does render the family unable to get a subsidy or be eligible for a subsidy if they're eligible for the employer's plan. Now, if you have an employer that excludes spousal coverage, then perhaps the spouse can apply for and be granted a subsidy. You have to look at those circumstances on an individual basis, and we'd be glad to help you with any of that if you have questions on that. Again, this has been the Healthcare Reform Question of the Day. If you have a question that you'd like for us to answer, please submit it to hcrquestions@KeystoneInsgrp.com. Have a great day.